we have a very special guest, Dr. MuthuJayaraman, and who is MD in General Medicine and MD in the nephrologist. And she was already with us on the March month, and basically she prescribed various technique for us in order to take care of our health and especially on kidneys one. And there is a follow-up discussion we are going to have, and in that our doctor we're going to explain more in detail about how we should take care of the kidneys and all that. It's going to be a very interesting discussion we are going to have. And with all this, I would like to once again welcome doctor for joining the call with us.
Thank you very much, Abrar, for calling me to talk about kidney issues.
Yes.
Thanks a lot.
Yeah. So the first question, I jotted down some question, doctor, and I request you to have a answer it. First question is ice-breaking topic, doctor. What motivates you to become a doctor?
I think it's mainly my teachers.
Okay,
my teachers from school onwards. They only, because I come from a small town in Tanjore district.
Okay.
At the time, education of women are not it's not a priority with the people.
Okay.
And so it was not a priority in my home also.
Okay.
But my teachers, when I came first in the district in SSLC, my school teachers came and insisted on me getting into the college.
Okay.
From then onward, in the college, in the medical college, that was again the teachers who insisted I apply for that. I got the seat.
Okay.
And in MBBS, my physician professor, who insisted on me join medicine, general medicine.
Okay.
And fortunately, I got a seat. Those days, no donation, no.
Okay.
Only merit matter.
Okay.
Then after MD, my teacher, Professor Amaresan, insisted on me joining nephrology. That's how again I became a nephrologist.
So inspiring to have
great,
this.
Great thanks to all my teachers on this day.
Yeah, great. So yes, doctor. And the second question is, once the patient realize that they have the kidney problem, general tendency is they get dejected, and how I should the whole pattern of food get changed, everything. And what advice you have for them, how they should accept the change, accept this phenomena, and move forward?
No, I do understand. Once people have a very bad impression about kidney diseases, they think it's not curable. They end up in dialysis. A lot of kidney diseases can be treated. Only thing you may need to have a follow-up with them. So it is not such a bad disease. Like when people are told that they have cancer, they get scared. Yes. Like that, they do have that, but nothing to be so feared about kidney problems. When they get dejected and we discuss with them, there are a variety of kidney diseases. Not everybody is a kidney failure. But when people say kidney disease, they think of only kidney failure. Okay. A lot of diseases which can be treated and prevent ending in kidney failure. And that's the thing we tell them. And we also tell them, you have to decide, make a diagnosis of kidney disease, what type of disease it is, whether treatable or curable or to be followed up, etc., with various investigations. That's very important for them. Excellent. As for the diet, and almost all the patients, we tell them to restrict salt. There are barring few who may need a normal salt diet. But salt, as you say, as people say, is a very important material in our food. All of us need 6 grams of salt per day. That's all. And if you know how much salt we are taking, you'll be surprised. We are taking about 20 grams, both in Tamil Nadu.
Almost 3 times higher. Yeah.
3 times, both in Tamil Nadu and Andhra, and probably whole South India. Whereas North, it is little less, because most of the salt is contributed by our pickles and all the salted food we eat. Okay. And that's why the salt has to be restricted to the normal intake to about 5 to 6 grams a day. But
Okay.
many of our patients feel very dejected at that low salt diet. And again, potassium we restrict in certain conditions of the disease, like chronic kidney diseases, which is progressing. And potassium is harmful to the heart. So that always raises when the kidney disease progresses. So we tell them to stop, reduce or stop potassium containing food.
Thank you so much, doctor. And there is one common phenomena that whenever they get the fever, they get the cold and all that, they go to nearby medical shop, and then they take the tablets without consultation with the doctor. And what impact does it bring on kidney, doctor, on the long term?
That's a very bad practice. Only in our country you can get all the medicines over the counter, and it should be made prevented. Only on prescription, people should be provided with medicine in most of the countries. But in our country, anything you can get it over the counter without a prescription. That should be restricted. And buying medicines, particularly the pain relievers and also drugs, people like pantosate, which is commonly used by people for gas and gastric problems, and they continue to take it for years together without any prescription. These two are very bad to the kidneys. They end up in chronic kidney disease, and if not corrected or treated, end up in renal failure. So, without doctor's prescription, it's better, or advice, it's better avoid taking medicines. Not only allopathic medicines, even Ayurvedic medicines and other medicines, you need to have a consult, and must know, the doctors know which one affects the kidney or not, then only take it. Unnecessary medicines should be avoided.
Yeah, thank you so much, doctor. And then there is a follow-up question that I recently read in a paper that many children got affected with the kidney diseases, and the paper goes to show that it is because of the incorrect prescription of syrups. And does the syrup also have an impact on the kidneys? But generally, it has been taken that syrup is only, it is common. We can take anybody, child can take the adult one and all that. So does it have anything relation with the dose and impact, doctor?
No, most of the medicines given to the children are in the form of syrup because they don't swallow tablets. So it contains various, like not syrup means all not same. Syrups are medicine, antibiotics are given in the form of syrup, cough syrups, and other things are containing various medicines are given. So syrup by name is a very general name. But there are certain medicines given which contain certain nephrotoxic medicines in one period of time, cough syrup, that affected the kidneys of many children. But every medicine given to the children must be weighed, correct dosage must be given, and they are usually given in the syrup form because the kids will swallow only syrups. So don't blame the syrups, you have to blame the medicine containing in that. And also prescription is essential, particularly for children.
Yeah, noted, doctor. Very, very good response. And when we say that chronic kidney disease, some case the patient has an infection around kidney, and they go through the course and they complete the course and all that. Still, they have to be very vigilant. And why it is called chronic kidney disease, doctor? When we say chronic kidney disease,
chronic kidney disease is the term any kidney problem, not necessarily infection. Infection is the last one, but any kidney problem which is present for more than 3 months.
3 months, okay.
With a fall in kidney function. This is called GFR. The kidney function is measured as GFR. When the normal GFR is up to 120 ml, and when it comes down below 60 ml, and there is proteinuria, protein in the urine, and sometimes followed with hypertension, is lasting for more than 3 months. It's called chronic kidney disease. Various diseases can cause chronic kidney disease from diabetes, hypertension, any chronic kidney problems, not necessarily infection.
Okay.
And if it reduces the kidney function, then it is called chronic kidney disease.
Yeah, good. Thank you, doctor. And we heard many diet type, more than 200 types. For example, keto diet and LCHF diet, intermittent fasting, DASH diet, and all that. According to you, what is the best diet in order to keep healthy kidneys and all that, doctor?
See, DASH diet is prescribed for diet appropriate for to reduce the hypertension. That's why it's called DASH diet. That's mainly salt reduction and more vegetables and less of fat and lot of fruits and vegetables. DASH diet.
Okay.
And rice and all be reduced. And main important thing is reduce the salt in the diet. That is to prevent hypertension or to control the hypertension. That is a diet prescribed. That's okay as long as you follow. So as I told you, salt is the most, we are taking too much of salt. And that's the most important reason most of us develop hypertension at some stage. Whereas keto diet, paleo diet concentrate only on protein and fat. And that's not at all good for the kidneys, particularly if you have a early kidney disease, we are not aware of that and start taking, and that's given for reducing weight, only protein and fat, no carbohydrates. That's not good for the kidney patients, and that should be avoided. That will worsen the kidney disease. Again, similar is a keto diet and LFH diet. All of them low carbohydrate, high protein, and some of them, and that doesn't contain high fat diet. They are also not good for kidney diseases.
Okay, good. Thank you, sir, doctor. Doctor, this is a common question that we get a lot of message flooded with in the WhatsApp and various social media one, and we immediately with something comes up, we try to follow that, and without reading through the sources, without knowing the authenticity of the content and all that, particularly home remedies and all that. So, what advice do you have, doctor?
That's the biggest problem we face every day. Every day, the WhatsApp messages and some of the messages are not authentic, not scientific, and it's just given like that. For example, I get patients taking one kirai called Mukkaratek kirai. They think that is the WhatsApp says that is good for your. Even yesterday, I met a patient like that. Good for your kidney, and that is very renal kidney toxic.
My goodness.
And particularly during the corona period, there was a lot of messages on the WhatsApp saying this prevents the corona. So a lot of my patients who are already having kidney disease started taking that and ended up kidney failure because the kidney damaged them. So please avoid WhatsApp messages. They are not doctors. They are not scientific. And if you want to know about it, just discuss with your doctor whether it is authentic, whether it can be taken. And otherwise, please avoid that YouTubes and other things. Particularly, it is not given by a scientist or doctors or something. Better not follow them. And that one of the reasons I think a lot of increase in the kidney problem of late.
Oh my goodness. Okay. So what is called cardiorenal syndrome, doctor?
Most of the kidney diseases, for example, the commonest cause of kidney disease in our country is diabetes and hypertension. And most of the kidney diseases, about 40 to 60% of any CKD patient have a cardiac disease. It's called cardiorenal syndrome. They are connected. They're the same disease. The hypertension, when it affects the kidney, it affects the heart also. Diabetes, when it affects the kidney, it affects. When the kidney problem starts and the kidney failure, kidney function reduces, that again affects the heart. This combination is a combination of heart and kidney disease occur in 40 to 60% of kidney patients, not otherwise. Not all cardiac patients develop. So this is called cardiorenal syndrome. So whenever kidney patients come, anybody, we always check the heart also. But whereas the cardiologists usually they don't check the kidney problem. They keep to themselves about the heart itself. But there is always a connection between the heart. Heart is the pump, kidney is the filter, we call it. Heart pumps the blood to all over the body. Kidney filters all unwanted things into the urine. So they are most important organ, of course, besides brain and other things.
Yeah, thank you, doctor. And how to increase naturally vitamin D, doctors? And some cases we have also seen that people started consuming it. People who go India to outside because they don't have a natural sun and all that, and then they get used to that vitamin D tablet every time they consume it. What impact it will have on the long run, doctor?
No, vitamin D is essential for our body. It's abundantly available in sunlight. But what's the problem is, but what's the present day problem is, most of us stay inside the AC room. We travel by AC car. We don't allow ourselves, expose ourselves to the sunlight. In a country like ours, you get vitamin D3 deficiency, nearly 60 to 70% of people. People should come out and walk in the sunlight. And hardly you see when the sunlight comes, everybody covers themselves or go by air-conditioned car, leave us work in air-conditioned place. So vitamin deficiency occurs, but that has to be estimated and vitamin D given appropriately, not regularly. People, as you say, people take it like continuously 60K vitamin D3, and that results in a lot of other problems. They may be toxic to the kidney, bones, and muscles. So the normal level vitamin D3 should be kept below 30, not more than that.
Thank you.
So somehow, unfortunately, in spite of the such huge amount of sunlight, we develop this because of our lifestyle.
Okay. There is also another question related to lifestyle, doctor. Now, outside food, generally speaking, has become a trend in the weekend, and the people also do an online ordering and all that, and then if in some cases actually it is okay because actually like people who stay in the hostel, they are away from the family is okay, but they make this as a habit, and they stop liking the home food and all that. Always the generation like young generation and all that, they like only that online order food and all that. What impact does it bring to kidney in the long run?
Definitely, if you know what all the food ordered, if you take a list of it, like pizza, pasta, and all contain lot of fat, lot of oil, and very unhealthy substances, not proteins, enough proteins. Because they may order non-vegetarian food that may contain protein like chicken or mutton. But our way of preparation is that you put a lot of coconut, lot of oil, lot of masalas and curry, and that's what liked by most of our people. They are unhealthy food. What we should eat is anything in moderation. Home cooked food is any day better, and with a lot of vegetables must be consumed. Chicken, fish is good. And mutton contains, if you cook the mutton, you know how the fat comes like oil on the top. It contains a lot of fat, oxalates, and uric acid. So if you eat a lot of mutton, you may develop cholesterol will go up, uric acid will go up, oxalates will go up. And if you don't drink enough water, you may develop stones. And also people with kidney disease must, by and large, avoid mutton. Once in a way is okay, but not regular. And online food, outside food, all contain unwanted things in large amounts like salt, oil, etc. So it's better avoid all of them, and unless it is a must, if you don't have any other alternative.
Thank you.
And
Good
that's why
response.
now
Yeah.
I see a lot of IT people. They sit about 8 to 12 hours on the chair and look at the screen and eat this online food. No exercise, no sunlight, and they put on weight. And most of them come with backache because the muscles are not
Yeah.
moved. And early onset of heart attack are very common. 35, 40 years old come with hypertension and heart attack. And that's because of this lifestyle, unhealthy lifestyle, food, no exercise. How food is important for us, exercise also equally important. And you have to walk according to your capacity. No need to go every day to gym and all. Daily walking about 45 minutes itself is good enough. Walking or jogging, running. And don't sit in one place. Another problem is this gadgets like phone, TV. People sit in one place and never move out of that. So all these have brought in a lot of diseases like high fat levels in the body, obesity, particularly obesity, and heart attacks, hypertension, etc. For example, in in uh, in Italy or in France, obesity is very uncommon because one thing, their food, Mediterranean food, they eat a lot of fish and olive oil. That's
Okay.
good. Olive oil contains a lot of HDL cholesterol, and that's good for your heart. Heart attack is not common like America and India like that, where we eat the other kind. And they walk a lot, not like getting out of the house, you sit in a car and move. And that habit has come, particularly in cities
Yes.
this, and that's why the heart problems are more common in younger age group.
Okay.
The lifestyle has to change.
Okay. Okay. Great advice, doctor. We shall follow that. Blood urea, how to reduce it, doctor? I think you also talked about it, but one question add on to it. Consuming pink salt, they say that it does help and all that. So what generally salt which we should use, doctor? The normal salt or in pink salt?
Pink salt is called rock salt. They
Okay.
contain more potassium. That
Okay.
should be avoided by the kidney patients.
My good.
But
Okay.
cardiac patients, they advise good potassium level is important for the heart muscle. So very often that's advised. But by and large, better to avoid the pink salt or the rock salt, which contains more potassium. Regular salt, iodized salt is good enough. But overall, any salt, even the white salt, has to be reduced in our diet. From small childhood, we have to start like that. Reduce sugars, reduce salt from childhood. We eat a lot of sweets. And every street has two sweetmeat shop anywhere you see, and in our country particularly. And when you go to somebody's place, we would take them sweets. When you go any function, we eat a lot of sweets. That's why diabetes is so common in India, and we have become the diabetic capital. And diabetes in the long run affects the kidney. The commonest cause of kidney disease in our country is diabetes. So please avoid sweets from childhood onwards, because when you develop a sweet tooth, you won't prevent it because availability is so much. And reduce salt from childhood. So people put salt in the rice itself. That should be stopped. And take what we are eating is, as I told you, 20 grams. That should
Yeah.
reduce. From childhood, we must get used to low salt diet. In Japan also, they eat a lot of salt, whereas rest of the world eats only 7 to 8 grams a day. That's the reason. Of course, they also develop for different reasons, but
Yeah.
our salt and sugar intake from childhood we must develop. Tell
Okay.
your children not, don't give the children too much of chocolate, sweets, and all.
Yeah. Thank you. Thank you
That's a
so much.
lifestyle.
Yeah. Yes. Yes, doctor. What is mean by lupus and how it impact kidney and how we can proactively, address or control it, doctor?
Lupus is an autoimmune disease. Lupus is a disease very common in women, young women of childbearing age, second decade or third decade. The ratio of men and women is 1:9. If 9 women are affected, one man is affected. A little rare in men. And particularly it affects the young
Doctor?
young children.
Yes, yes.
Sorry,
Yeah,
calls are
okay.
coming.
Okay.
I'm not seeing myself.
I think that it is got stuck actually. Yeah.
Can you restart?
Yeah, sure, doctor.
It has come.
Yeah,
Yeah.
yes, doctor. Yeah.
What was he telling?
You were talking about, you were describing about lupus, doctor. Yeah.
Lupus. Lupus
Yeah.
is more common in young women. That's a disease, an autoimmune disease. That means our body develops antibodies. Antibodies that affects our various system of our uh, on all our system in our body, skin, kidney, heart, muscles, joints, and including hair fall. They are very common in lupus disease. And what is sad is it affects more often the kidney. And if you don't treat it appropriately in time, you they go into renal failure. But fortunately now we have enough adequate treatment. If you treat early and appropriately, new drugs are coming into that, and we get a very good, the longevity of the patients are much better. It used to be 10 years earlier. Now they live 15, 20 years. They may marry and have children. Earlier, we used to tell them not to marry, not to have children. Everything affects the kidney and the disease. So, but it still affects the very important age in the young women, the second or third decade, and affects the life in many ways. But we do have a good treatment right now. We can
That's a good
manage it.
news. Yeah, that's a
But
good.
there is we can't say this is the cause of this disease. Your own body produces antibodies, your own body tissue. Why it happens, nobody knows.
Okay, understand. Okay. One last question, doctor. Said COVID is slightly surging back again, and
Yeah.
what is the best advice you have for all the people, doctor?
Bring back all the COVID regulations.
Okay.
Please avoid crowd
Okay.
and start wearing mask.
Okay,
Mask
doctor.
wearing and keep the distance and
Yeah.
avoid meetings. Like the meeting should be like this
Yeah. Yes. Yeah.
over the web, not
Yeah.
on meetings,
Yeah.
marriages,
Yeah.
temple functions, meetings, all should be reduced and keep space between two persons. That
Yeah.
is the most important thing. But we do not know yet, is this the same Omicron or is it a modified one? But because China is affected, they don't tell us the truth.
Yeah.
They won't. They know the facts, but they won't tell it out. They tell no deaths, but they say per day 30,000 people are affected
Yeah.
there and all that. So unless it is analyzed by a scientific way and tell us, and it started coming. That's the very sad thing.
Very sad.
But we have to prepare. If those who are not taken booster, please take it. And
Okay.
they say there is a nasal vaccine is going to come. Let us see what is the
Okay.
report about it, and
Sure.
then we all can have it. But best thing is wear mask, avoid crowds,
Yeah.
and keep a distance from each other. That's always good.
Okay. Thank you so much, doctor. Anything you would like to add, doctor? Thank you so much.
I am very thankful to you, Abrar, for calling me to talk there, because awareness about the kidney and various diseases is very, very important. Whatever we talk as a scientist in a scientific way won't go as much as well as the WhatsApp messages and all that. But this should be reached to common people.
Sure.
And they can ask questions. They can say various things. But the best one thing I wanted to tell people is avoid over-the-counter medicines. Reduce the salt from childhood onwards. Reduce the sugars from childhood onwards. And don't become obese. Obesity is another cause for various diseases. And keep active, physically, mentally active. These are the 5 important messages. So many things are there, but this keep active, particularly physically and mentally and correctly.
Yeah, sure,
Thank you
Doctor.
so much.
Thank you so much, Doctor, for all your time, and I'm sure that everyone will take advantage of this QA session which we had, and it's such a wonderful session we had with you, Doctor. So much, thank you so much, and we shall definitely follow that. Thank you so much once again, Doctor.
Thank you, Abraham.
Yeah, okay. Take good care. Bye bye, Doctor. Bye bye.